This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep.
Who are learners with exceptionalities? Learners with exceptionalities are students who have special educational needs in relation to societal or school norms. An inability to perform appropriate academic tasks for any reason inherent in the learner makes that learner exceptional. A handicap is a condition or barrier imposed by the environment of the self. A disability is a functional limitation that interferes with a person's mental, physical, or sensory abilities. The often arbitrary classification systems for learners with exceptionalities are widely debated, and the use of labels may lead to inappropriate treatment or damage students' self-concepts. About 13% of students ages 3 to 21 in the United States receive special education services. Examples of learners with exceptionalities are students with intellectual disabilities, specific learning disabilities, speech or language disorders, emotional and behavioral disorders, autism spectrum disorders, and vision or hearing loss. Students who are gifted and talented are also regarded as exceptional and may be eligible for special accelerated or enrichment programs. What is special education? Special education programs serve children with disabilities instead of or in addition to the general education classroom. Public Law 94-142 in 1975, which was amended by PL 99-457 in 1986 to include preschool children and infants with serious disabilities, is now called the Individuals with Disability Education Act, or the acronym IDEA, IDEA. It mandates that every child with a disability is entitled to appropriate special education at public expense. The current version of the law, IDEA 2004, calls for greater involvement of parents and classroom teachers in the education of children with disabilities. The least restrictive environment clause means that students with special needs must be mainstreamed into general education classes as much as possible. A requirement of IDEA is that every student with a disability must have an individualized education program, which is called an IEP. The idea behind the use of IEPs is to give everyone concerned with the education of a child with a disability an opportunity to help formulate the child's instructive program. An array of services is available for students who are exceptional, including support for the general education teacher, special education for part of the day in a resource room, special education for more than 3 hours per day in a special education classroom, special day schools, special residential schools, and home and/or hospitals. What is response to intervention? Response to intervention, or RTI, means using modifications to instruction or intensive services in the general education classroom before referring a struggling student for special education. RTI approaches generally provide struggling students with 3 tiers of intervention: prevention, whole class; immediate assistance, small group or individual; and intensive extended assistance. What is inclusion? Inclusion means placing students with special needs in general education classrooms for at least part of the day. Full inclusions of all children in general education classes with appropriate assistance is a widely held goal. Research has shown that inclusion is effective in raising many students' performance levels, especially when cooperative learning, buddy systems, peer tutoring, computer instruction, modifications in lesson presentation, and training in social skills are regular parts of classroom learning. What are effective strategies for students with disabilities in general education? Teachers in inclusive classrooms can help their students with disabilities succeed by adapting instruction and modifying materials, teaching students specific learning strategies, and providing tutoring and computer practice.